At this time, I just want again to join Sister Lisa in welcoming Brother Mr. Osgood Hector with us here this morning. He's a busy person and he accepted willingly to be with us the last time and even to be again today to continue the class that he did not complete. So we are thankful to him for that. So the next person you'll be hearing is Mr. Osgood Hector. Welcome, Mr. Hector. Please take over. Thank you.
Yeah, thank you very much. Good morning to everyone. Good morning. It is absolutely a pleasure to be here this morning so that we can continue this very exciting topic, as everyone would enjoy first aid. And we said last time that we call our class First Aid Rangers. And we said that the world is very happy that we are First Aid Rangers. When things start going wrong, when people start getting injured, you know, we have First Aid Rangers that can step in and save the day. So it's very important that we take this class seriously. It is a continuation. How many people remember anything from last time? Let's say about types of bleeding. Tell me one type of bleeding and how we stop. Anybody?
Atrial bleeding.
Okay, we have atrial bleeding. Tell us, Miss Defo. Tell us a little about it. Atrial bleeding is. Anybody else want to help Miss Defo? Let's pop, let's pop, let's pop. You said we have atrial bleeding, and atrial bleeding refers to bleeding that happened as a result of an artery being severed. All right, arteries being severed, and that means that blood will be very powerful. It will be spurting, it will be nice, bright red, and it is very difficult to stop. It is life-threatening, and so we must find a way to stop it very urgently. All right, and that's something that we remember. What about fracture? Anybody? Miss Host, could I have permission to share my screen?
Sure.
Sure.
A fracture is any break or discontinuity in the bone.
That's it. Excellent. Any break or discontinuity in a bone. All right, how do we treat fractures? How do we deal with fractures? There's a term that we use to deal with fractures. It's an S word. Somebody tell me. Tell me, anybody?
Splinting.
That's it. We use splinting. Now, it's important for me to note this morning that fractures are could be very severe because of the blood vessels that usually run alongside the bones. And so a fracture, which is a break in a bone, can cause one of your blood vessels, artery or vein, to be damaged and cause severe bleeding. If we want to take this note down, that there are about 206 bones in our bodies, about 206 bones in our bodies. You can take this as a nice little note to take down. 206 bones in our bodies. And about 33 bones make up our spine. Okay, and so these are the bones that would be involved in fractures. All right. Okay, so as we continue, we're going on further to other types of, let's say, emergency situations. situations, and we said that emergencies are incidents that happen and that require the response of emergency personnel. All right, that requires the response of emergency personnel. And so some of those injuries or events or incidents involve seizures. All right, now we have some bright people here. Can you see my screen, everyone?
Yes, sir.
All right, so we want someone to read the first point that we have here about seizures. What is a seizure?
A seizure is a set of uncontrolled electrical activity between brain cells that causes brief abnormalities in muscle tone or movements. These are stiffness, twitching, or limpness, behaviors, sensations, or states
of awareness. That's it. So we usually refer to a seizure in the medical field as an altered mental status. All right. It really is a nervous situation, a situation that has to do with the brain or the nerves. All right. So you would see some things like stiffness. We could see twitching, limpness. We could see the person acting funny. All right. Especially just before the person, go into what we call convulsions and so on. We will see some funny behaviors in the person. All right. And this is a very serious situation because obviously it has to do with our brain. All right. We have the epilepsy or fits and convulsion. A fit is a chronic neurological disorder that causes repeated seizure activity. All right. Seizures on its own really in the individual occurrences of the abnormal brain electrical activity. All right, the seizures on its own. But when we have epilepsy or fits, it really has to do with that constant or that chronic thing where somebody, you say that when somebody get fits, you say that person usually get fits. All right, so that person is epileptic. So we would see that thing happen anytime, sometimes different stress situations. The person here is at school, you're playing or you're in class, and then the person probably just go into a daze. The person make a kind of song, funny song, a sigh or some groan, and then the person usually fall to the floor and then, start checking, stiff. All right. Convulsions, that's the next thing that we want to remember. Convulsions, which are sudden, violent, irregular movement of the body caused by involuntary contractions of the muscle. Convulsions are sudden, violent, irregular movement of the body that is caused by involuntary contraction of the muscle. So that really has to do with the shaking that we see people who are epileptic or people that get fits, what we say. And even, depending on the type of seizure, if the person have what they call the grand mal seizure or really big, bad seizure, you'll see the person have convulsions. So the person would have that violent shaking of the body. All right. We look at it. What do we see there? Causes of seizures. We want somebody to read for us. Let's go. Causes of seizures. Let's pop.
Causes of seizures: drugs, alcohol or poison, brain tumors, infection and high fever, diabetic problems, trauma, stroke, heat stroke, epilepsy, and unknown causes.
And then some causes are unknown. All right. Some causes are unknown. Thank you very much. Excellently done. All right. So we have a keyword there. We have poison, something that happens when someone is poisoned. That is also a cause of seizure. Brain tumors, these very unfortunate events and situations that we go through in this world, because like we said earlier, that the world is not perfect as a result of sin. And so these are the things that happen. Really unfortunate that somebody has a brain tumor. Other infections. Sometimes we talk about fractures and so on, where we have bleeding taking place because of ruptured blood vessels or open fractures. We take note of that with the infections, because somebody can get infected through some severe traumatic injury. And because of those infections, we can have the person suffering from seizures. All right, we have some things like stroke, heat stroke. Now I want us to take note of that, because we have a heat stroke. Heat stroke really would happen when what happens? Can anybody tell me what instance or case where somebody might suffer a heat stroke?
Extreme heat.
One brief person. Say again.
Extreme heat or high temperature.
That's it. Extreme heat or high temperature. Sometimes people playing sports and and really determined to win for the house, and they really overheat. So that's why sometimes you see, people during sports day, we have those things, those unfortunate events where people, would collapse and start shaking and those kind of things. And then you would see teachers and so on running across and start to unbutton their clothes to make them get some air and fan them. That's not bad. All right, all these are good first aid steps to take when someone, especially in a hot situation, start to go through those conditions. All right, so these are some things that we must take note. It also tells us that we have to be very careful when we are in hot situations. We have to be very careful when we over-exert ourselves. We have to be very careful. All right, sometimes people do work or sometimes play in, and the sun is very hot and we want to remain there. We want to get it done. We want to finish, but that can cause seizures. All right, because that can cause a heat stroke. Okay. Somebody else read for me. Signs and symptoms.
Signs and symptoms. Sudden loss of responsiveness, body will stiffen, apnea, incontinence, convulsion, and confusion.
That's it. So we mentioned those things already. Now, signs and symptoms. A sign really is what you can see. All right. So you can see the person body stiffening. We can see person having convulsions and so on. But there are certain things that you cannot see. The symptoms is what the person themselves are experiencing. So the person themselves will experience confusion and so on. These are things that we look for. We look for signs, and the symptoms usually is what we ask the person. We ask people whenever someone is going through some event, some incident, we ask them questions, and it's not just because we're asking, just so. All right, we're asking certain things because we want to be able to tell, what is going on with the person, and we can only know the symptoms that a person is experiencing if they tell us. All right, we can see signs, but the symptoms are what the person can tell us. We clear? Now, what do? We place the patient on the ground, loosen restrictive clothing. Do not restrain the patient. After the seizure, place the person in recovery position, and of course, protect the person's privacy. All right, remember the person has an altered mental status, so the person is not really thinking properly, or the brain function is not as normal, as yours. So the person really would be having no control over their body and what is going on. So you, as the person who is giving the intervention, you want to take responsibility for the person's privacy. That involves not just going and spread the person's business. If the person is exposed in terms of their clothes, you want to cover up the person. But now there's something, it says place the patient on the ground. In in cases, usually the person will collapse, or sometimes maybe a person sitting in a chair and maybe in a funny position. So we want to place the person on the ground. We want to loosen. Somebody saying something? We want to loosen any restrictive clothing. All right. There's a point there. Do not restrain the patient. Do not restrain the patient. All right. Now, sometimes somebody is having those convulsions or seizures or fits, and you figure because you see the person on the ground and the person shaking, you want to hold the person and grab the person because you want to prevent the person from shaking. No, you don't do that. What you want to do is help the person to prevent the person from causing harm to themselves. So if there's a chair in the person's way or close to the person's body, close to the person's head, what you will do is remove the chair. All right. If you see the person is going towards a wall shaking, if you can get some cushion, you can place it, against the wall so that the person doesn't hurt themselves. There are certain cases because the person is loose and the tongue in them out, they become loose. If possible, you can place what we showed what was a bandage last time I was dressing. You can have a roller bandage or some nice soft cloth, some cloth that we roll up and place in the person's mouth to prevent the person's tongue from being caught by the teeth. Okay, these are some of these steps or the emergency care that we can take. There's not much we can do, but we can try to protect the person from causing harm to themselves. All right, everybody there? Everybody good? Making sense? We good?
Yes, sir.
Okay, that's good. All right. Now, I wish we could have been in a physical setting, because all things like placing the person in a recovery position, we could do that. We could get a chance to demonstrate. We could get a chance to practice all that, how to place the person in a recovery position. But it really is a position that you put a person, like that comfort position when you lie down, like you're going to sleep. Like that position you take whenever you want to relax, your first position to sleep. We're talking about when you just knock out. It's probably on your computer, you're on your phone and the phone fall on and it's in your face because you're falling asleep. But when you really deliberately lie down to take a rest, that nice comfortable position with your hand under your face turned to the side, that is the kind of position that we want. One of your leg is up, bent, nice comfort, one straight. This is what we want to do, because we want the person to be in a calm kind of position. So whenever they wake up, they will be in a comfortable position. Because there's a next point that we can note, because the person lost consciousness, whenever the person regains consciousness, they have a tendency to become combative. So the person might, fly up. And maybe if you hold in them or something like that, the person can hit you a lash, and it's really of no control. It's just a natural reaction as they start to regain consciousness. So that's why you want to put the person in that recovery position and you want to leave the person there. You monitor the person, you leave the person there while you call, obviously, for medical attention. As we said, the first aid, obviously, is the steps that you take to help the person before being transported to a medical facility or before professional help arrives. All right, never forget that. So we want to protect the person at all costs. Okay. So the next thing we go into is poison. Anybody have any question? Does anyone have any question? Anything they would like to ask? Any experience they would like to share?
No, sir.
No, sir. All right. So we move on to poisoning and bites and stings is what I have here. All right. So a poison, you can make note. A poison is any substance that can be harmful to the body. Any substance that can be harmful to the body. And it's going to be harmful to the body whenever it enters the body. And we have here basically 4 routes of poison, or 4 ways that a poison can enter our body. Anybody read for me?
From routes of poison, sir.
Yes.
Ingestion by mouth, inhalation by breath, absorption through the skin or tissues, injection entered into the bloodstream.
Entered into the bloodstream. Okay, so we have the 4 routes. It can be by ingestion. That is what you take in the mouth. All right. Ingestion, what we take in through the mouth. Inhalation is what we inhale. You know, you could inhale a poison. It could be you cleaning your bathroom and your foot bleach in the bathroom. Right? You clean the bathroom, you're inside there, the door's closed, and you clean away. You scrub in your bathroom, you pour how much bleach, you still pour how much fabuloso, and you close the door. And then, you know, your parent, they wonder, you know, how come they don't see you for how long? And then by the time they open the door, the scent of bleach and all of that hit them in the face, and then they see you lie down flat in the bathroom. All right, that is where you inhale all that toxic fumes. All right, so bear in mind that is something I don't want to do. They don't want you to do. All right, you just take how much bleach and put in a closed environment, because that can poison you, that can cause you to fall down and render you unconscious. Okay? Am I making myself clear?
Yes, sir.
Okay. We have absorption is through the skin. Absorption through the skin. And we said that the skin was our first defense. All right. We said we had how many layers of the skin?
3.
All right. We had 3 layers of the skin. We have the epidermis, the dermis, and the subcutaneous layer, which is beneath. And we mentioned that when we spoke about burns. All right. The last one we have is injection. It could enter into the bloodstream through injection. And that, you know, people play around with needles. You know, you can, anything that would prick you with poison. It could be a snake. We grateful to God that in Dominica we don't have poisonous snakes. Right? But all these are ways that we get poisoned. But we have bees, and so we can get bee sting. Okay. We still together?
Yes, sir.
Yes, sir.
Okay. So we can see everybody seeing. Oh, I would have to share.
Yes, sir, we seen.
Are you seeing what you seeing?
Detergents and flammable
Okay.
stuff.
Or a picture, right?
Yes.
Yes, sir.
Okay. Let's see. That'll be even funny. All right. So these are some of the common household poison, and you see what the big thing I was talking about there, regular Clorox. All right. We have things like Baygon, well, really big one, but roach and killer, but things like Baygon and so on and Bob. That is the next thing. If you're going to spray your home, you want to be out of the house quickly. All right. So we can look at some poisons there, basically ingested poison and some of the signs. Now, if someone has ingested a poison and you look at them, you could see burns or stain around the person's mouth. All right, you could maybe have take some funny scent from the mouth. Abnormal breathing and pulse rate. You could see sweating. You could see changes in the pupil, from dilated, constricted. Okay. So we can tell. The whole point is we want to be able to tell what is wrong with a person. And that's why we said about sin size up earlier on. We spoke about sin size up is really observing the area and what is going on. So when you see, if you see somebody on the ground, or if somebody come to you, you know, looking weak and confused, you can look at the person and that can tell you if you see maybe burn around the person's mouth or stains. It's just like, you know, when people eat pen, somebody put pen in their mouth and all the ink blot out in their mouth. You know, you can see. So once you see the person's mouth with the collar, you can say, ah, you have ink in your mouth. You know, especially with children, younger children. All right. We could see all of that. Ingested excessive saliva, abdominal pain, vomiting. Can anybody tell me what is our normal pulse rate? What's our normal pulse rate? Can anybody tell me what's our normal pulse rate?
I don't know, but maybe it can be on around the hundreds.
Around 100, around the hundreds or around 100?
Around
Anybody
the
else?
hundreds.
Not hundreds. One. You should not pass 100. At rest, at least. Like to say you are calm sitting here, your pulse, if I am to check your pulse, then and I'm to count it, then I'm supposed to get anywhere between 60 to 100 beats to the minute. So over 1 minute period, I should get anywhere between 60 to 100. All right, when you're at rest. Obviously, if you are exerting a lot and you're probably running and all those things, it would increase, but it will not get past 120, because once your pulse rate really get past 120, it's cause for concern. You know, so the normal, if it's below 50, let's say below 50 and above 120, like it's lower than 50, like let's say 40, between 40 and 50, that area there is too low. All right. Or if it's past 120, 125, 130, even 140, especially young children like yourself, that should be your pulse rate. And obviously, if the person is older, the person really should have a pulse rate between 60 to 100. All right. So we say the abnormal pulse rate, you should get 12, at least 12 breaths to the minute. Okay. Inhale poisons, you would see shortness of breath or coughing, abnormal pulse rate. You could see irritated eyes because obviously the poison is in the air. Okay. Safely remove the patient from the source and maintain an open airway. Make sure that the person is in a position where the throat is open for air to pass through nicely. All those things happen, we must ensure that we call for help. Even before we attempt to do anything, or while we are checking the person, we must look to call for help. Look this way for some general rules for the treatment of poison. The first thing you must do is protect yourselves. Protect yourself from being overcome by a poison. Well, let's say not yourself, but try to protect the person from being overcome by the poison. Yes, we said BSI, we must take care of ourselves. We must ensure that we are safe. So we put our gloves to ensure that we don't contaminate our own selves. If we go inside a bathroom and probably someone may be full up there with bleach and the scent of bleach, you know, can overcome you, yes, you be very careful with that. So you protect yourself from being overcome by the poison, protect the person from being overcome by the poison, remove the person from the danger source. That's the next thing we want to do. Pull the person away from the source of danger, from that poisonous area. It could be, the poison could be on the person's skin, so we definitely will wash the poison off. The person could be in a poisonous environment because it's inhalation. We want to pull the person away. The person may have some injected poison, like probably a bee sting, could be a snake bite. With a bee sting, we want to, you know, scrape off the like stingers. all right? And we arrange for medical aid. We always call for help, always call for help. Injured. Don't ever enter a place if it is not safe for you to do so. And if you cannot make it safe, then you certainly should not enter. It doesn't make any sense that you go where you cannot make the environment safe for you and you just become a patient yourself or just become a victim yourself because you cannot help the person, you still cannot call for help. So the first thing you do is you call for help and you ensure that the place is safe for you. Dilute, eliminate, or neutralize the poison. Okay? Dilute. So that's why you give water, you give some fluid to drink. You have milk and so on that people give, you know, in case of ingested poison. Neutralize the poison. We have, do not give fluids if the victim or the person is unconscious. All right. If you try to give fluid to a person who is unconscious, the person cannot drink the fluid. What you're gonna end up doing is pour the fluid straight down the person's lungs. All right. So do not give a person any fluid if they're unconscious. And we're saying the person is unconscious, you calling the person doesn't answer. You shaking the person, you know, you squeezing the person's fingers or nail beds or anything, applying pain also to the person, and the person's still not responding. All right. All of those things, after you do all those checks, okay, you see the person is not responding. Do not give any fluid. We have here, do not give any emetic if the poison is corrosive. For example, if a person may have ingested gramaxone or some other, you know, weedicide, do not give anything to cause the person to vomit or try not to induce vomiting. All right, because that kind of poison is corrosive. That poison, it goes down and it has that burning effect as it goes down, burning all the lining of the esophagus, burning the lining of the stomach. So if you make the person vomit, you're going to make that whole process, you're going to redo that process. So when it already went down, you don't want it to be coming back up. Because as it's coming back up, it's going to do the same thing, burn more, eat up more, and that kind of thing. All right. What you can do when you see a person vomit, if the person may have vomited, you can, when you call for help, you can collect, or if you have to, you know, transport the person, or you're able to get the person to medical facilities, maybe you get someone to come, you know, pick you up, you get a neighbor also to come with the person, then you can scoop up some of the vomit to take to the doctor. So you take the vomiter sample to bring to the doctor. That could make them test it. And especially in the cases where you don't know what the person may have ingested, that can give the doctor a good sense as to what is going on, and that will help with the person's treatment. Because what you ultimately want is to put the person in a better situation. You want to help the person to preserve their life, all right? To prevent any further damage or injury. That's the whole point of your intervention. That's the whole point of your first aid, okay? So let's not forget that. Now, next thing we want to talk about is what to do if a person has suffered electrocution, all right? What to do if a person, you come and you meet a person being attached to some power source. So somebody going and trying to plug something, maybe trying to plug an extension cord, and they trying to open the terminals of the live and the neutral for the pin or the charger to go in. And they're using something, some knife, they're using something iron, some steel piece. You know, somebody end up touching a live terminal with some metal, and now the person is attached to that, hold on to that, and they're shocking. If the person is actively shocking, you do not want to just go and touch the person. you don't want to just touch the person, because it's simple. You going to create a path for the current to enter your body as well. All right. And so both of you are going to be shocking. Again, you cannot help the person because two of you need to be helped. What you can do is use some piece of stick and disconnect the person from the electrical source. Disconnect. Don't take it. Some people, you hear somebody say, hit them like a piece of wood. Don't do that. You know, you basically any part, whichever part of the person's body that is making contact with the power or the electrical current, you want to just gently dislodge it using something that is not conductive, something that does not pass the current over. So a piece of wood is a good place to start. All right, don't go and take a piece of iron and try to dislodge it, because again, you're going to be making contact yourself, and that is dangerous for you. You're going to shock too and become electrocuted. All right, now electricity have that dangerous effect. Electricity can burn the skin because that it enters your body, you know, it heats up the blood and all the blood vessels and the cells, and you know, cause rupturing of blood vessels, you know, internally, and cause severe burning internally, burning of the hand wherever that's making contact, burning up of the skin, you know. So you don't want to take this lightly. All right, somebody just get a shock, and you know, the person okay, they stop shock, and you find okay, the person still can talk to you, is you still try to take the person to a medical facility, because usually you cannot see some of the damage that the current, you know, is doing. All right, so electricity causes severe burns, and we spoke about burns already earlier in this session in our first class. We spoke about burns and the severe effects of burns. All right, so when we have people exposed to electricity, we have severe burning of the skin. But the thing you want to do is know that electricity is your friend, but it can be your worst enemy. So you want to be very careful. You want to be very respectful to electricity. All right, now we could have the person after they, you know, have received electrocution or been electrocuted, the person may be rendered unconscious. You want to check that. If the person is no longer making contact, or if by your intervention you were able to dislodge the person and now you see the person is unconscious, you know, that is by, you see the person is not breathing. Probably the person is not breathing. You can see, or maybe the person is breathing, but the person has an abnormal pulse rate. That is cause for concern. To waste no time with that. Now we have not talked about CPR. I'm not sure how much of CPR we know, but maybe if that could be some discussion for our next class. But if the person is not breathing and there is no pulse, then we do CPR. Now CPR in our assessment, we want to check circulation, we want to check airway, and we want to check for breathing. All right, circulation, we know we check by checking a pulse, and we spoke about the pulse, and we have the radial pulse there in the forearm, that lateral part of the forearm. We know that by the wrist there, we know that is where you can get the pulse, or by our carotid artery. Now we have our radial artery right there, something to note again, our radial artery. So it's a radial pulse we'll get here, and a carotid pulse in the neck. And we see that plenty time in TV, on TV watching movie, touch the person's neck, and that could tell you, okay, whether or not the person has a pulse. You want to look at the person's chest, look for the rise and fall of the person's chest. That will tell you whether or not the person is breathing. Will tell you whether or not the person is breathing. Go ahead, Ms. Defoe.
So what is your pulse rate supposed to be between what number?
Say again.
Your question. Your pulse rate supposed to be between what number?
60 and 100. From 60 to 100 beats per minute. So what we can do is once we apply, we use our two fingers Do not use our thumb because obviously our thumb has its own pulse there because it has its own radial pulse there. So we want to use maybe the index finger and the middle finger. All right. And we apply gentle pressure just enough for us to feel that pumping, that beating. Once we can feel it, we can take a phone, we can take a watch, and we can count for 15 seconds how many beats we get for 15 seconds, and then we multiply by 4. We can do it by 30. How many we get over a 30-second period? We can multiply it by 2. Or we can just go counting from 1, watch the clock from 1 second to 60 seconds, a minute, and how many we get. All right, so 60 to 100. If the person is 100, no need to panic. It will be on the high side, but once it's between that range, it's said to be normal, especially when a person is at rest. Like I said, if the person is running around and exerting, then it would be slightly higher. But if the person is, relaxes for maybe a 15 minutes, then it's supposed to go back to normal. Okay, so we'll still go back to normal. So no need to panic. As the first aider, okay, check the person's pulse. You get 60. You can tell the medical personnel that this is what I got. The pulse rate was that, and the breathing was that. 12 was 8, it was 9 breaths per minute. That means the breath we measure it is let's say every rise of the chest, because when it rises, it falls. When it comes back, it can count. That was 1. Up and down again, that was 2. Over a minute, we could tell. Now, a next little thing we can say, if we check in for pulse, we want to check the pulse to ensure that it has a normal rhythm. We want to check the strength, that it is not too weak, that you're applying pressure and you feeling like you barely can feel the pulse. All right. Or sometimes you're feeling a light one day, you have not moved your position or your grip, and then you feel a next solid one, then you feel a soft one, then you feel a solid one. That would tell you that the person pulse is irregular. And that also is cause for concern, because the person should have a normal rhythm. All right, the rate should be between 60 to 100. The rhythm should be constant. The strength also should be constant. All right, that could tell you if you have there is any cause for concern. All right, clear? Not clear?
Clear.
Yes, sir.
Sleeping? Okay, all right, good. Okay, so any other questions? As we consider we come to the end, any other questions? Let's not forget the general rules that we must follow in poisoning cases. Let's not forget that. Let's not forget that whenever a person is suffering from seizures and so on, that we don't try to restrain the person and fight with the person. We want to allow the person to go through the episode, but just protect the person's privacy and protect the person's health. Try to prevent as much as possible the person from causing more harm to themselves. Okay, so as much as possible, if you can just pull the person away from a dangerous area, maybe the person maybe was cooking and the person collapsed, thankfully they missed the pot, and you see the person still around the stove and plugging up, and if you can just gently pull the person away from the stove, turn off the stove or move the stuff from the stove, that could fall and end up injuring the person. All those things, just make sure, again, remember, your responsibility as the first aider is to protect the person and prevent further injury, preserve the person's life. So you want to check for the airway, breathing and circulation, ensure that there's breathing, there's circulation. You want to ensure that a person has, normal temperature, the person is not hot, burning up, and always remember to call for help. As a fire officer, I know, and I can tell you that in the case of fire, for example, everybody will take out a phone before they try to take out phone and record before they call for help. When the fire started, everybody probably tried to take water, a little bucket of water, a little cup of water, and all that kind of stuff, and trying to dash on a fire that is getting out of control before they call. Even if in a fire situation, the fire is small and you figure you can handle, you call. While you're trying to do your little first aid stuff by throwing little water, call. So at least you getting help on the way one time. Because just in that case, the sooner the help arrive, the more the fire will remain under control. The sooner the help arrive in a case where somebody have an emergency, a physical or medical emergency, it is better for you. The sooner the help arrive, it's better for the person. Okay, clear? Okay, so if there are no more questions, I think we can call it a day, and any other time we can have another session. Okay, thank you very much for being attentive, for being good students.